Hello everyone, welcome back to my channel Medical's Guide. It's Dr. Rida Khan, and from now onwards we'll be studying prosthetics and orthosis. And firstly we'll cover the orthosis and then we'll move forward towards prosthetics. So let's get started. Now in the orthotics, firstly we will begin with the introduction or the basics of orthotics. So these are the three definitions. The first one here is the orthosis, and these are different terminologies you must keep in mind. So orthosis is basically an external appliance that is worn to restrict, that is to inhibit the motion, and to assist, that is to support the motion. And it also transfers the load from one area of the body to another. Now the old name for that, for the orthosis, or the synonym for the orthosis, is the brace. And the orthosis is used temporarily. Once the individual gets recovered, the orthoses are removed. Now, who is orthotist? Orthotist is a healthcare professional who designs, fabricates, and fits the orthosis for the limbs and trunk. And you must remember this difference, that orthotist is responsible for designing, fabricating, and fitting the orthosis for the limbs as well as for the trunks. While the pedorthotist is a healthcare professional who designs, fabricates, and fits only the shoes and foot orthoses. As the word ped here in the pedorthotist refers to the foot, therefore we can say that he is responsible for fabricating, fitting, designing the shoes and the foot orthoses. Now let's talk about the key elements in preparing the patients to use orthosis. So these key elements are here: the orthotic design characteristics, the purpose for using them, that is their biomechanical rationale, the merits of specific material, that is the material from which the orthoses are made of, then criteria for judging the adequacy of orthotic fit, function, and construction. Now let's move ahead towards the important terminologies and the types of orthosis. So the first one here is the FO, that is foot orthosis. Now, as the name indicates, that it is applied for the foot only. So it is applied to the foot, and these are placed inside or outside the shoes. For example, it can be a metatarsal pad or the heel lift, both of which are placed inside the shoe. Then there is AFO, A for ankle, F for foot, O for orthosis. So ankle foot orthosis, and the name indicates that it encompasses the shoe. And it is below the knee, that is the termination is below the knee. Now the KAFO, that is K for knee, A for ankle, F for foot, and O for orthosis. So this is the knee ankle foot orthosis, and this is from the shoe to thigh. Now HKAFO, that is hip, knee, ankle, foot orthosis, and this is basically similar to the KAFO, but there is additional pelvic band that surrounds the lower trunk. Now THKAFO is the trunk, hip, knee, ankle, foot orthosis, and it covers the part of the thorax as well as the lower extremities. Then lastly we have the cervical orthosis, and this is basically used to encircle the neck to provide support to the neck, or to allow the movement or to restrict the movement, as we have earlier studied about it, that the purpose of the orthosis is to support or restrict the movement. And then we have the trunk orthosis, and these are named by the motions that they control. And there is one scoliosis trunk orthosis that is named after a city. Now lower extremity orthosis. So these orthoses comprise of the shoes that are used for the clinical purposes, to the THKAFO, that is used to support the whole, you can say the foot, ankle, knee, hip, trunk, so all of those structures. Then there are KOs, HOs as well, means that they are separate orthoses as well for the hip, for the knee. And there are also some orthoses for the special purposes, like in the case of the LCP, that is leg calf Perthes disease, which is basically the avascular necrosis of the hip. Orthoses are also available for the upper limb, but they are less frequently used and they are only used for a brief period. Therefore, we won't study the orthosis for the upper limb here in this orthotics chapter, but we'll study deeply about the lower extremity orthosis. So now that's all. We have just discussed about the introduction to orthosis, and from the upcoming lectures, we'll take a deeper look into the different types of orthosis, lower extremity orthosis, as well as the foundational structures that are the shoe and the other structures that form the basis of these orthoses.